Welcome to Villanova Health Summit on ReachMD. Coming to you from the Villanovans in Healthcare speaker event held on campus at the School of Nursing is keynote speaker Lawrence Sherman, Senior Vice President of TOPEC Global.
We want to really talk tonight about team, about interprofessional, about communication, about working together, and how that fits in healthcare now and healthcare education moving forward. Does that work for you guys? How many of you, to some degree, are involved in healthcare, either in delivery, in payer side, in manufacturing side, patient care, education, anything like that? Okay, so you are on the right, you're in the right room. They say that when you make a talk personal, it has more impact. And the title of my talk is When a Medical Educator Became a Patient. It changed my view on interprofessional healthcare, interprofessional education, and everything about it. Now, here's the coincidence, and I really appreciate the fact that as a non-Villanovan, no direct or indirect tie to Villanova, except I think working for a company that has the highest percentage of employees with degrees from Villanova than any other company in the world. Which had me cheering for and being a part of Nova Nation this year, which was great. I appreciate being asked to be a part of this. And what was really coincidental is I had a health issue that started 1 year ago today, just by coincidence. So 1 year ago today, that's me in the black. I was running in a 5K race at JFK Airport where you run up a runway and back a runway. They don't let you keep running on the runway because there's airplanes and you can get hurt, right? So I ran a 5K race, I had a decent time, and then I had to fly off on a business trip. As Brian said, I do global education. I was on my way to Dubai. That's me in front of the Burj Khalifa 2 days later, April 21st. April 21st, I had just given a talk, and I was out at a dinner, having a great dinner. Fantastic. From there, I flew to Frankfurt. I had a series of meetings and dinners. And then on April 25th, that's what I looked like. I was in my hotel room, had dinner, went to sleep, woke up, threw up. I said, boy, that German food got to me. No. As that day progressed, my abdominal pain got worse and worse. I teach emergency medicine. I diagnosed myself with appendicitis. So I called up and I said, please send an ambulance to take me to a hospital that can do surgery. They sent an ambulance and an anesthesiologist, who will forever be my best friend. Because I was in, when you have a surgical abdomen, when you need surgery, an acute abdomen, you have something called intractable pain. I've taught about intractable pain forever. I never had it. Once I had it, I knew what it was. I couldn't move. I couldn't find a position to be comfortable in. Anesthesiologist came in and said, don't worry, I would give you a shot and you would feel great. You know what? I felt great. Fantastic. So I had an interprofessional team in my hotel room of paramedics, firefighters, and an anesthesiologist who took me to a hospital where the head of emergency medicine said to me, I've got this. I've got the head of surgery coming in. You're going to be fine. They admitted me. They did an ultrasound by an honest-to-goodness radiologist, not a technician. They did an ultrasound because there they do ultrasound, not CAT scan. They confirmed the diagnosis. They said, go to sleep. Not for the surgery. They said, just go to sleep. Talk to the surgeon in the morning. Surgeon came in and said, what do you want to do? You're the decision maker. You are a part of the team. So now the interprofessional team involved me. And he said, here's your options. We think it's early appendicitis. Here we do watchful waiting. You can fly home, be evaluated at home, have the surgery at home. What would you do? Would you have the surgery in Germany, get it done with, or would you go home? My insurance covered everything. Raise your hand if you would go home. I went home. The beauty of it was the emergency room doctor said, don't you worry, this will be the best plane flight of your life. I felt great, right? Because he made sure that I was comfortable for the flight, and he signed me out. I didn't go against medical advice. I went, I was discharged, I got home. 2 days later, I woke up in the ICU. I landed, I went, my friend evaluated me. He brought in the appendix guy of Long Island. He went in with the scopes. What was supposed to be 45-minute surgery turned out to be 2 hours and 45 minutes of not only resecting a perforated appendix, but a gangrenous appendix, gangrenous cecum. I had ruptured 7 days earlier. See me running in that race? That's when they think my appendix burst. And I was septic, and they said that had I gone 24 more hours silent, I'd have been dead. So I became a patient. I was in the hospital for 8 days, and I felt the value of interprofessional care and communication between the team and everybody really addressing the needs that I had and involving me in every decision. It changed the way I look at medical education 180 degrees. 180 degrees. So let's talk about how medicine is now, what healthcare education is now, and how we can take my patient journey and see if we can learn from it and maybe make a difference, okay? So there is a definition of interprofessional education. And when we were planning this talk, a lot of discussion happened about, well, is it multidisciplinary? Is it interprofessional? Is it interprofessional continuing education? There's a real definition. Interprofessional education means 2 or more professions learning with, from, or about each other. And it doesn't matter what the professions are. The professions don't have to be clinical professions. They could be any professions. So when I asked you if our panel was interprofessional, our panel is 100% interprofessional. Interprofessional clinical and beyond. Because we sometimes forget to include those people who are decision makers and who are involved in impacting the journey of a patient before, during, and after their care in some of the interprofessional education that we do. Multidisciplinary, by definition, means 2 or more disciplines within a profession. So just so that we can agree today, for the purpose of this talk, interprofessional is 2 or more professions learning with, from, and about each other. Okay? Good, I can get it. I only have like 47 more slides. I love this quote from my friend Brian Hodges and Lorelei Lingard, where it talks about how a football team, now we know football is soccer, but in the rest of the world it's called football, they spend 40 hours a week to practice for only playing 2 hours. We should be thinking about that in healthcare education too. And it's not just practicing by ourselves and learning by ourselves and with our own people, but maybe we need to be practicing with everybody else. That makes sense? I really like that quote, and that's why I brought it into this. Now, it wouldn't be Villanova and it wouldn't be 2016 if I didn't bring this up. But I have to tell you, this is the perfect example of teamwork. When I talk interprofessional, we can exchange that for team. There was teamwork here. And the father said it really nicely. Mop the floor, get the ball, pass the ball, score. No one person wins a game. A team wins a game. It's a team effort. Healthcare is a team sport. Healthcare is a team sport, and all of the players have an equal role. Nobody's more important than anybody else, and a patient is an important part of that team. But I had to figure out a way to get that in there, and it was just so easy. And it made sense. Now here, I like this quote: if you want to go fast, go alone. If you want to go far, go together. So when you think about it, do you want to go fast? Do you want to get to the end? Do you want to be just you or your individual profession? Or do you want to take the team approach and go as far as you can go? When we think about healthcare, when we think about healthcare education, when we think about how do we teach our people, the more we involve everyone who has to impact a patient journey, the more important it is. So I think about this, and you'll notice there's not a lot of data in this presentation. This is meant to make you think about the team and interprofessional relations and interprofessional communication. And this one's fun. I saw it. I have this file. I don't know if you have this, but I call it presentation images. And I save all these things, and then I say, I really hope someday I find a chance to use some of them. And I was able to use some of them here because they really rung true on this topic. Now, when I is replaced by we, illness becomes wellness. Now, if that doesn't speak to healthcare, interprofessional teams, then nothing does. It has to work that way. There's no two ways about it. It has to work that way. And when we're thinking about teaching, We need to teach together as well. My son is in the process of starting college in the fall, and he's looking at a 6-year PharmD program. And the thing that they're trying to sell us on this 6-year PharmD program is that they do interprofessional education from the beginning. So the pharmacy students, the nursing students, the medical students, the nutrition students have classes together so that they learn about team-based care starting from their earliest days in school, so they're prepared to be out in the world when they have to do actual practice and work together. So instead of teaching them separate, sending them in and say, play together, we're teaching them together from the start, and that's really important. Problem is, the patient is in the center of this diagram, isn't he? But I know those of you that are clinical have probably seen this type of scenario before. There's 2 people consulting on this patient, but what's not happening? Communication between each other, with the patient. One of the key quality competencies of team-based care is effective communication. And if you're not effectively communicating, then there's going to be a problem. And we see this all the time. We see this all the time when we do education and we say, what are the barriers to effective transition of care? Handover, referrals. And it's because the person that sent me that patient, that primary care guy, didn't know what I needed. Or the specialist didn't tell me what I should have sent, so I didn't send it over. It doesn't happen everywhere, but we hear this. Those are barriers. So effective communication and learning together can get past that. There was a movie out recently, Concussion, right? And it raised a lot of issues, social issues, but concussion is also one of those things where there has been a tug of war between who owns that patient, who should take care of that patient. It shouldn't be who owns that patient, it's how should we work together to take care of that patient to make sure that the outcome of that patient is best. So that's one of those things that we see, that we need to make sure the care is coordinated, that there's communication, that there's no battle, and that the patient is cared for appropriately. And then how do we measure? Can we measure how well a team works together? Can we measure the effectiveness of team-based education? And you have to start out by defining it right. So if you have a proper definition, you could measure whether that definition was met. So I like this one, which is a team is not a group of people who work together. It's a group of people who trust each other. This way, if they have learned together and they have to practice together, if one isn't there, there's no question as to what they would have done. There's trust that that team will behave in a manner that that team was prepared to do. So when you think back to that last second shot, there was no question. There was a pass to the person who was best to make that shot. It's no different in healthcare. Absolutely no different. The person who's making that decision or who's providing the care or giving the service or providing the reimbursement or whatever that decision is the right one because they're prepared the correct way. Now, here's an interesting thing. We aim in a team to reach collective competence, right? So together, remember that was that question I asked you before? Together, they will behave in a way that the outcome will be correct, will be the best, will be optimal. Now, this is a picture, it was from a presentation I saw in Canada. And those people fighting in this particular example are the different provinces. But it could be anything. To me, it represents all of the people who are battling over the patient care. And I don't know if you can see it, but it says fundamentals of surgery. Because the patient said, you know what? I'm the most important person on this team. Everybody's fighting over me. I've got to get this done. That's not where we need to be. So to Brian's question, where are we, where are we going? We're not there. We're past there. But we need to get far past there. So as I wind this down, because they told me not to be too wordy because the panel's the important part, the interprofessional panel is the important part, one of the things that I always think about is what's a good example from outside of healthcare that really makes the point of how a team should practice and behave well. And I think an orchestra is really a good example. If the violins only practice with the violins, then this is what it sounds like. Right? But when the entire orchestra practices together, while the violin was beautiful, the orchestra makes music. So the team has to behave together. Does that make sense? Now, that doesn't mean the violin was bad. That violin was pretty good. Certainly wasn't me or anybody in my family. But you got to think about it from that perspective. Now, let me just give you an example to tie this up, and before I turn this over to Brian. One of the examples I like to use is we've done education in type 2 diabetes, a prevalent disease that's all over. And we identified a need where primary care, endocrinology, and diabetes educators were all seeing patients, but not at the same time, and sometimes not communicating, and sometimes some of them weren't involved. And what we did was we brought them together, and we didn't give them slides. We made them sit together at tables and talk about how to manage a case. How do you do this? Brian, you can comment on this if you want in a bit. But we said, work it out, and then present back to us. And we had a panel of a primary care physician, endocrinologist, and a diabetes educator. And we made them think. And these were some of the comments that came in at the end. We said, how will this change the way you practice? One said, making the patient more empowered to help make decisions. We liked that one because we got them to think about making sure the patient was consulted in their ultimate health care. Someone else said, increase focus on social support, psychosocial, and supportive group therapy. So instead of just saying, here's your medicine, take it, go for a blood test, come back. If it didn't work, we'll change it. They started to think about how to involve more interprofessional management of the patient. And the last one is network with other care providers, contact referring providers to discuss options of treatment. In this case, they're able to say, I'm not going to be the only one to make the decision. Let's figure out, diabetes educator, what we need to consider so that this patient will have the best outcome, will stay on care, will make the right dietary changes, and have the best outcome. And I know I said not too many statistics. The only one that really echoed true for me is we said, vote here. Are you somewhat likely, very likely, whatever? So when we said, I participate in transitions in care for patients with type 2 diabetes through effective interprofessional collaboration. Before the education, we said, I do. After the education, we said, I will. And we moved from always or will always do or sometimes to always do. We moved them from 60% to 98%. And even if not all of them follow through, what we did was we got them to think about managing their patient, impacting the journey better. If we could now extend interprofessional education, interprofessional continuing education beyond that to really impact patient care and improve lives, I think we're doing a good job. So with that, I want you to remember my story. Don't worry about the statistics. Don't worry about 60 to 98%. Think about my story. Think about how it relates to interprofessional care. Think about how that last-minute shot, because you may forget everything about today, but you're not going to forget that victory anytime soon. And when you're thinking about healthcare, maybe once in a while, tie it back to healthcare.
You've been listening to Villanova Health Summit on ReachMD. For access to this and other episodes from Villanova University, and to download the ReachMD app, visit reachmd.com. Thank you for listening.